Welcome back. You're still on to Journalist Hangout. Now, cancer of various types is still a menace to the society. Without known cure for cancer, experts are harping on early detection for effective management of the ailments. And to this end, wife of the Kebbi State governor and founder of Medicaid Cancer Foundation, Zainab Bagudu, called for provision of screening services at primary health care centers across the country for early detection of cancer. Now this, she said, will also increase cancer awareness at community level, since most Nigerians live in rural areas and lack access to basic care. Well, let's share the story with you before we go into our discussions.
Cancer remains a major leading health problem worldwide. Every year, an estimated 10 million cases are recorded globally, 6 million of which result to death. In Nigeria, it is estimated that 72,000 cancer deaths out of 102,000 cases diagnosed annually occur in a population of over 200 million people. A carnival-like atmosphere as men, women and children take part in this 5-kilometer awareness walk on cancer from Utako through the streets of Abuja. Participants drew the attention of many as they walked, sang and merry. The organizer, supported by her husband and other notable personalities, says support is needed from multinational organizations to increase awareness and bring fatalities to the barest minimum.
We also come together in such a large group to make a statement to the policymakers, to the government, to even the pharmaceuticals, to say that this many people are worried about cancer and we need to do something about it. By coming together, our voice is stronger.
In Kebbi, we have an indigent fund that was, again, her pioneering work to mobilize money to support the indigent who are affected with cancer, which has led to, at the national level, adoption of a catastrophic cancer fund.
Aisha Umar is the Director of Clinical Services at the National Hospital in Abuja. She says 40% of cases handled at the hospital are cancer-related.
The problem is that they come late. Because of this, the outcome is not the way we expect.
Participants said the walk was eventful.
Now I'm feeling better. Yeah, I like it. I'm feeling better. But what I will advise is not only in Abuja. You understand? Let's go to the locality, local area, like state, local government.
Achieving less number of deaths from cancer is what awareness programs like the one that just ended hopes to achieve. But participants say while sensitization continues in urban centers, our rural areas should not be neglected in the drive to create adequate knowledge about the killer disease. Joke Adisa, TVC News, Abuja.
Well, let's discuss this very briefly now. Babajide, talking about cancer, we know that there's so much awareness, in town with regards to how we can detect this early and prevent, any disaster that may come out afterwards. But what's your take on the level of awareness, starting with the rural areas? Are people really aware of what cancer is and how one can really prevent it from getting that worse?
Certainly the awareness is not enough, and that's why we've got to praise the wife of the Kebbi State governor, Dr. Zainab Bagudu, for the role that she's playing. Everyone needs to jump in. Everyone needs to play his part to ensure that we bring down the rate of fatalities from cancer. 72,000 cancer deaths in our country every year. That's huge. That's huge. And 102,000 new cases discovered every year. So out of the 6 million global deaths from cancer that we record each year, you can see that Nigeria plays its own part negatively. So we need to do a lot more by way of awareness and by way of even setting up those cancer screening centers so that people can discover the ailment early. Once we are able to do that, we'll be able to save a lot more lives.
Sam, in your own position, do you think we have enough cancer screening centers? I'm sure we are, lacking behind in that. But what can we do? What more can be done so that people get access to healthcare facilities that have these centers at their beck and call?
Investment. The government needs to invest more. We already have a situation where Nigerians are not getting, the best out of our healthcare system. So there are, shortfalls all over the place. So only investment, and that is why, this noble cause by the wife of the Kebbi, governor, is one that should be commended. We need to have a lot more awareness. We need to get the authorities, appreciate that, access, to early diagnosis is very important, in managing, the cancer scourge. Indeed, the cancer scourge is one that I can relate with. I lost my dad to prostate cancer, and it's a disease that kills rapidly, very expensive to manage, and that is why the government needs to commit a lot more resources into it. Thankfully, the world is experiencing a lot of advances, in the medical field. But it would take, early diagnosis for different forms of cancer, cervical, prostate, like I said, breast cancer, and all that. Once you are able to,
early detection.
Early detection, and then you can begin to manage them. My dad, like I said, had to live with it for almost a decade, and that was because we were able to detect it early. But then. Cancer is the sort that kills, in a way that you really can't explain, So it's good to see, advocacies of this kind, all over the place. We want to recommend that other, prominent Nigerians who are of means and of influence, should commit themselves, to activities like this. Right. That way, you have, many more people access in. Cancer care.
All right, now we understand we have the wife of Kebbi State Governor, Dr. Zainab Bagudu, and she joins us from our Abuja studio. Good to have you, ma'am, on the program this evening. So let's begin with this now. Medicaid Cancer Foundation champions is nationwide cancer awareness in our country. What prompted you now to focus on cancer, and what successes are currently being achieved?
Well, thank you very much for having me on the program. It's been a long fight against cancer. What prompted us was really the need when I started looking after, I'm a pediatrician by training, which means I look after little children. But as we all know, it's the mothers that bring children to the hospital. So when I was seeing my patients, the mothers would come with one issue or the other that is private and related to their, most of the time, breast, because as we know, breast cancer is the commonest cancer in Nigeria and indeed the world. So I was doing that, and gradually I got drawn into women's issues, this private issue about their breast. And I realized that there was so little awareness. People didn't know, the women in particular didn't know what to do. They didn't know where to go. They didn't know how to seek for assistance, at what stage. This was even in an urban area. And so as I progressed in it, we would get drawn into more and more things, supporting treatment, screening, trying to diagnose earlier, trying to diagnose better, to get the right diagnosis. And of course, then we started venturing into policy advocacy, that is working with the government at different levels in the Kebbi State. We work with the Kebbi State government, the Ministry of Health, the Federal Ministry of Health, and internationally as well, globally, to try and seek better policies for cancer control. Have we made an impact? Yes, I believe that we have made an impact. And I believe that the more we do, the more people get aware and the more they want to know. Maybe when we started 13 years ago, our foundation would see about 10, 20 patients a month seeking for support. For us in low middle income countries and in Nigeria, particularly the area that I work in, the commonest need is support, financial support. Like Sam said earlier, cancer is very expensive. Anybody that has dealt with it or has come close to anybody dealing with it will tell you that it's not supported by our health insurance system. And so the greatest need that patients with it have is financial assistance. They need money to get to the hospitals that are far from where they are. We have less than 6 good functioning cancer centers in the country. They're expensive, and also even the chemotherapy and what you need to sustain life. So it can bankrupt even the well-to-do. So we have achieved a lot. Now, I was saying before, we would say about 10 patients. Now, on a monthly basis, we get requests upwards of 100 asking for financial support and different questions to do with cancer. In the 13 years, we have been able to impact over 60 million people in terms of directly reaching them and doing something through various means.
Now, we understand you are a pediatric consultant, and one of the most painful realities about cancer is the fact that it even afflicts little children with, like, brain tumor, for instance, leukemia, lymphoma, and others. Now, have you had to deal with this kind of situation? Are there things now parents can do in this regard?
Yes, like you say, pediatric cancer is a reality as well. But I'll first say the good thing about pediatric cancer is that it is 85 to 95% curable. However, that depends on which parts of the world you come from. The high-income countries can cure it because the drugs are available and detection is early, and the equipment to make the diagnosis and the system, like the primary health care centers we were talking about earlier, there's a good healthcare system that picks up cancers in children early. But if you come from a low middle income country like us, the cure rates or the prognosis of cure is between 25 to 45%, depending on where you come from, for all these reasons I've mentioned. So that is the downside of pediatric cancer in the tropics, or should I say in the low middle income countries. It is a curable cancer. It has a very good prognosis. Some of them are hereditary, some are due to toxins, but most of the time it is curable. We find lymphomas, leukemias, yes, we've come across quite a lot of them. There are some centers in Nigeria that have excelled in looking after them. The University of Ife is one of them, but they're relatively easy to manage. It's just that we don't pick it up early. Unfortunately, most children's illnesses, they get treated for malaria first before anything else, and then they start to dig deeper, by which time it has gone to a later stage. And then, of course, the population, the majority of our population reside in the rural areas where access to healthcare is really not as good as it should be.
Okay, how important is our environment to cancer prevention? Looking at environmental pollution, illegal mining, deforestation, and other things happening, especially in the Northwest.
I'm sorry, I missed the beginning of the question. All I heard was environmental pollution.
Yes, I was talking about, I said, how important is our environment to cancer prevention, looking at environmental pollution, illegal mining, deforestation, and some other...
Excellent question.
Yes.
Excellent question. I like that. Climate change is a reality that we're facing, and also environmental pollution is one of the biggest causes of climate change. And that same environmental pollution, toxins in our environment, we litter our environment with things that we shouldn't, so that biodegradation is poor, and we have all sorts of chemicals released from industrialization. Mining, whether it is illegal or legal or illegal, produces a lot of toxins. There is a particular area in Kebbi State where mining activity is high. I have also personally witnessed a higher rate of cancers from that area. And we all know that even in Zamfara, the areas, some of the areas where we have problems are areas where there's a lot of illegal mining going on, and the children get, or even adults tend to get poisoned. So it has an effect, and is one of the reasons why we are seeing an increased incidence. The presenter before in the earlier clip mentioned about 72,000 cases, deaths annually, and about 102. Those are actually figures from about 3-4 years ago. The current last year, according to GlobalCan, which is 2020, these figures have risen. We're now looking at 128,000 cases detected with about 78,000 deaths annually from cancer. And like you rightly said, Babajide, the majority of the deaths of cancer in the last, or the occurrence and the deaths from cancer has been in Africa. In the last 20 years, it has doubled, and we're expecting to see another doubling before the year 2030. So these are all the kind of things that is causing us to see a higher incidence. Our children are eating more refined foods. We're using antibiotics more. Our natural immunity is being depleted. Cancer is a very fine balance of the gene with your immune system. Some of the new drugs are playing on the immune system. So once that is not balanced properly, you will see that there is an increase to the negative of cancers and such illnesses. The cells just go crazy. They're not able to control themselves properly, and the normal regulation is disrupted by all these things. So it is a problem. And then we have other things like COVID last year saw us with an unprecedented pandemic that the world has never seen. This affected all our cancer screening services, our cancer treatments. There were only 1 or 2 hospitals in Nigeria that were able to continue delivering cancer care. And it also brought to light the inequities that exist between us and the high-income countries. Just as we saw with the COVID vaccine, there are a lot of gaps when it comes to cancer care. There is a cancer that we can eliminate, which is the second commonest cancer in women globally. That is cervical cancer. There is a vaccine against cervical cancer, which is the HPV vaccine, is against the human papilloma virus that is the most common causative agent of cervical cancer in women. However, this vaccine is not readily available to women in Nigeria and most other African countries because of the cost and because of the, it's not available. There is a long waiting list, and the Western and industrialized higher income countries have the wherewithal to buy it at the higher price, where we have to go through systems and so on that gives us at a lower price, and it's just not available to our girls. Meanwhile, in the other countries, even boys have started receiving HPV vaccine.
Sam, you have a question?
Yes, I do. Your initiative has come highly commended, and the figures that you have shared, are comforting in terms of the impact which you have shared, with Nigerians who are watching and listening. But there is also a concern, Madam, that programs, of the sort that you have initiated sometimes don't get to outlive those who have initiated them. What are the concerns? What would you like to speak to this issue? What are the guarantees that this initiative of yours is going to outlive you after you leave office as First Lady of Kebbi State?
Well, I didn't start the Medicaid Cancer Foundation as the First Lady of Kebbi State. I started it as the wife of Atiku Bagudu. I started it as Dr. Zainab Bagudu. He wasn't even in the Senate then, and he certainly wasn't the governor of Kebbi State. Like I said, it's a foundation that I started out of the need of our people, and it has grown. Today we were awarded an award by the Federal Ministry of Health as the best cancer NGO in Nigeria. I am a board member of the Union for International Cancer Control, which has nothing to do with my political affiliations or platform. And we do an enormous amount of work. The clips that you've shown from the Walkaway Cancer happened in Abuja, not in Kebbi. And the reason we do that is to show that we are a national and a global organization. And our aim is to reach every Nigerian and also to make it sustainable. Okay, we do some work in Kebbi. What if we were to concentrate all our work in Kebbi? What will happen? That is why it will not be sustainable, because another government will come. I will not have that platform again. Even if they are very friendly, there are ways in which I will not be able to operate. So at no time did we base our work plans on Kebbi. I will not deny the fact that it has been an enormous amount of support, and His Excellency in particular has been very supportive of our initiatives. In the States, I think we're the most advanced when it comes to cancer control. We have been able to do so much. I won't even, just to mention a few, we have a costed state cancer control plan. We have our own oncology units. We've been able to employ for the first time oncologists in the States. There is an indigent cancer fund, which is contributed to by the state governments and high net worth individuals. There are cancer registries, which is looking at the data in the state and trying to get better statistics out of it. And then also, there's so much that goes on there. We have people, outreaches that go on in all the rural villages. So that on its own, they have been able to achieve all those things because of the support and the work that the Medicaid Cancer Foundation does, with support, of course, from the government.
All right.
But I'm sure that I'll be here talking to you. How long is this term? Another 2 years, 1.5, 2 years.
Okay, let me quickly ask you this last question. Let me quickly ask you this last question. As a country now, what steps can be taken to achieve the global target of reducing cancer by 25% by the year 2025?
Well, one of the major steps that we need to take is to urgently institutionalize a screening service. The way we can get to this target is to detect earlier. We cannot detect earlier if we're not screening. And we have primary healthcare centers well distributed across our country. What we need to do, which we have been able to do in some of our PHCs in Kebbi, is to make sure that there's screening. We also need to hike up our awareness. Awareness is such a low-hanging fruit. The typical narrative of, oh, it's the devil's disease is something from, strange. You go to church, you go to the Babalawo, you go to the Malam and take concussions. We have to try to change the mindset of our people in the rural areas. And this is one of the advantages that I have found. And then after awareness, the next thing, of course, is funding. I have mentioned this. The National Health Insurance Scheme of Nigeria needs to clearly tell us what kind of cancer treatment is included in the scheme. Yes. The basic healthcare packages should include basic screening and treatment for cancers. Right now, there's a lot of, we're not sure, maybe, maybe not, and there's some that it will cover, there's some packages that it won't cover. But as an urgent need, we all Nigerians that have health insurance, the national health insurance, need to be protected and covered for cancer.
All right, and that's a fine place to leave it. Dr. Zainab Bagudu, wife of the Kebbi State Governor and founder Medicaid Cancer Foundation. We appreciate your time with us and Journalist Hangout this evening.
Thank you so much.
Thank you for having me.
And good luck.
Well done.
Thank you for acquitting yourself competently.
Well, that's about it on today's edition of Journalist Hangout. Join us again tomorrow for another episode of the program.